Hello everyone, and welcome to another Living Life Naturally this morning. Here it is in the morning on Eastern Standard Time, Pacific Time, I believe, for you, Dr. Jenny.
Yes, it is.
So today I have with me Dr. Jenny Tufenkian, and she is a naturopathic physician and a functional medicine educator. And she teaches patients, students, and physicians to increase understanding of complex chronic diseases. And as she educates, she empowers. So no matter to what audience, she instills new perspective, awareness, and ultimately hope. She sees the potential for a positive domino effect of her work. By guiding others to increase their energy, they in turn have the vitality to live their purpose, to shine their light fully and benefit all who cross their path. So Dr. Tufenkian has been treating chronic illnesses for 2 decades. A CFS sufferer herself, she's had no choice but to dig deep into the literature and uncover the root causes of CFS. Through her research and experience, she's developed a very effective roadmap for lasting change in her patients, and she sees them flourish after they had given up all hope. So many of these patients had seen many wonderful physicians, but they didn't know how to assess all the potential root causes of ME and CFS. And so she realized that she needed to create and share her own clinical wisdom with the wider medical community. So Dr. Jenny is a licensed naturopathic physician who got her training and residency at the National University of Natural Medicine. And she went on to be a sought-after adjunct clinical faculty member and ran her own successful private practice in Portland, Oregon. Dr. Jenny holds a BA in political sociology from Evergreen State University. So she absolutely loves to teach, and she's created an online and in-person tools for practitioners and individuals who desire to live with more vitality. And she's also a mum of 2, happily married, and loves her time outdoors and in the kitchen. So welcome to the podcast, Dr. Jenny.
Thank you, Lynn. Thank you so much. It's just a pleasure to be here with you.
Yeah, so how is the weather in Portland?
You know, it has been amazingly beautiful. We get these gorgeous Septembers where it's cool and blue skies in the morning, and then it turns into 80 degrees in the afternoon, and we just love it. So it's amazing.
Awesome.
Yeah.
So I'm really interested or excited to dive into you specializing in treating ME, CFs, and burnout. So would you explain to our listeners exactly what that is?
Sure. So ME stands for myalgic encephalitis, and that's what this condition is called around a lot of the world. And there's been and chronic fatigue syndrome is CFS. They're really, I see them as being the same thing with different nomenclatures and different communities. And then there's burnout, and some people. So there's a cross correlation between all of these. It's really ongoing exhaustion. It's exhaustion, and some of the hallmarks, or the thing that makes it chronic fatigue syndrome or ME versus just I'm tired, is that it doesn't matter how much rest you get, you're still exhausted. It doesn't matter. And you can sleep 12 hours and still be exhausted. You can take a nap and still be exhausted. It just never goes away.
And how does the normal Western physician treat that issue?
Well, and there's been a real, historically, this condition was, unfortunately, a lot of people weren't believed when they came in with it. It's predominantly women who have it. Some men get it, but it's more often that women get it. I think this is partly due to our physiology, and it's partly due to culture, which we're happy to dive into if you want to chat about that.
Well, I've got 2 cultures I'm dealing with, so.
Well, both of the cultures that you're from, it plays into the same thing, where women tend to take on a lot. We tend to do a lot for other people. We tend to push ourselves. and we tend to push ourselves beyond our boundaries and not listen to when we need to rail it in and take care of ourselves. So that's but there's also some biological things in terms of being higher in estrogen that can maybe set you up for being more likely to have chronic fatigue. But Western, the way it's conventionally treated and assessed is, one, if your physician believes you, which is great if they do, but often it's dismissed because it's just like, oh, honey, you're just doing too much. You need to take a break. I was told at one point by a neurologist that I just needed a 2-week vacation and then I would be fine. And that's not the case. Right. It's a very different kind of tired than I just need a break. So most physicians, if they understand how hard this disease is, they're very compassionate, and they will offer things like antidepressants, thinking that maybe that might help you feel better if you're not feeling so down. Or they may offer I had compression stockings if you're having problems with your circulation, or they may offer stimulants for some people. They may try to give you some extra electrolytes or something like that. But I have not yet seen a real ability to address the root cause amongst conventional doctors at this point.
So I think that this is kind of addressed because in the health coaching world, a lot of people call this the mystery illness. It's one of those mystery illnesses because it's very real. But as you say, people don't know how to treat it or don't know enough about it. But you struggled with this condition yourself. So tell us a little bit about your journey.
Yeah, I'm actually really curious to hear what you're saying about it was considered the mystery illness in terms of with the coaching. I didn't realize that it was discussed like that in the coaching world. So is that, I mean, like, can we just talk about that for a second?
Yes, so it is because, as you say, it's unknown and unrecognized very much in the medical community, but yet it's very real. So that along with my mind just went blank, but there are several that go into that. Fibromyalgia is another one.
Absolutely.
Kind of all falls into that mystery illness, because for some doctors, they'll never find the root cause. They don't know what the root cause is. And so they tend to dismiss it. And so there are many of these type of autoimmune type diseases, and in the coaching world we have just labeled them the mystery illnesses, because as far as the medical profession is concerned, they're a mystery. I don't know if they don't want to know about it or if they just can't find enough information about it. But you'll find in the coaching realm, many coaches will deal with it in the same kind of way that you deal with it, because it is real and there are some natural ways of being able to help.
Yeah, absolutely. Yeah, I think that's really true. And there's, I think that what happens in conventional medicine, and it's no fault of the individual, very compassionate physician or care practitioner that wants to help people, but I think it's a mistake in the way that the scientific method and training that we get stuck in, where we are always looking for what's the one thing. And I think that's the biggest mistake that we have been making with chronic fatigue and fibromyalgia, is saying there's got to be one thing. And once we find until we find the one thing and we have the test that proves whether you have that one thing or not, we can't really consider it a disease, and we obviously can't have an effective treatment until we all accept there's the one thing. And part of my journey, and I'll dive into that in a second, was really trying to find what is the root cause of chronic fatigue. So my situation is that I first got chronic fatigue when I was a second-year medical student, and I decided to become a doctor when I was 6 months pregnant with my first child. Went through pre-med as a single mom, ended up marrying his dad, started medical school when he was 3, still hadn't slept through the night because he was a terrible sleeper. So I started medical school sleep deprived, loved it. But then my second year I had tried to have another child, had a miscarriage, had a second miscarriage, which is second trimester, 17 weeks, awful hemorrhage, died. I mean, it was just horrendous, rushed to the hospital. And I lost a lot of blood. And that event threw me into what I call a dark night of the soul. I'd also lost 5 very dear people to me that year. And I was in medical school and I had a kid, and I really hadn't taken the time or space to honor all the emotional and spiritual, energetic, all the processing that happens when you're going through all this. So after the miscarriage, I was just in bed. I was literally stuck. I was there for months and months. I couldn't eat. I couldn't sleep. I had IVs in my arm. I mean, I was very ill. I was very ill. And I learned a lot in that time. And it was one of those processes that you would never wish on anyone, but you would never want to take back either, because of what I got out of it. It really allowed me to heal some very old things. And it also allowed me to really open up my whole spiritual world in a beautiful way, and has served me since. I got out of bed onto the couch due to the amazing healers that came to me and helped me. But I ended up having this diagnosis that I rejected, called chronic fatigue syndrome, after that. And for years after that, I was tired. I drug my way through the last few years of medical school. I felt like I was 102. And I was like so tired. And I threw everything I had at it, and I finally did get out of it. And so I knew that, and I got so much energy. I called myself 150% better. I opened clinics. I was teaching. I had another kid. I was running the house. I was literally doing everything, and felt amazing, and didn't think I'd ever get it again. And then I did. I got an injury. I got frozen shoulder. I had perimenopause. Like, all this stuff happened at once. And I really quickly slid down this slide. And it was kind of shocking to me how fast it happened, in terms of sliding down into this place where there's deep, deep fatigue. And I was really terrified that I was going to end up in the same situation where I was going to be in bed. But this time I had this huge overhead in my clinic. I had employees. My family was dependent on my income. And I literally was facing bankruptcy if I stopped working. And it was bad. So I did the only thing I knew I could do, which was I had to figure out how to heal. I knew I'd healed before, but I knew the things that I did, but those things weren't working. I had to figure out something else, and I had to go deeper in. And I could only hope that that time I really didn't know if I was going to get better or not. And I stayed up, I couldn't sleep because of the pain. So I just researched, and I researched and researched and researched. And this is when I discovered that there's so many people trying to find this one root cause. And yet when you really look at it and you take a step back, you can see that there isn't one root cause. There's a grouping of root causes that lead to the same thing and interact with people. And this is what I found in my literature. And once I started applying these things, this path that I discovered to myself and then to my patients, it was amazing to see the transformation.
So what kind of things do people need to look for to see the difference in their own lives between just low energy and, I mean, let's face it, sometimes we just feel, as we call it in England, bone tired. You're just tired to the bone.
Right.
But that's not always the same as a ME or CFS or just burnout. So what should people look for to know possible differences?
Right. That's a good question. Again, it comes back to is your bone tired due to something that makes sense? And do you know that you can do something to get your energy back? So, so the difference is that when I was in therapy for all of the depression and anxiety that I had after this miscarriage, which was severe, and I was working with this hypnotherapist who was amazing. She saved my life. But I remember I was complaining about being tired, and she didn't get it at that point either. And she was like, "Oh, I'm tired too. Everybody's tired. I'm tired. She just rented one of those carpet cleaners, and she had carpet cleaned her whole house after a day of work. And she was really tired. And she's like, I'm exhausted. I'm tired. Everybody's tired. And I remember thinking, it's not like that. It's not like that. It's not, when you're tired with chronic fatigue, you don't trust or know that your energy is going to come back. And that's what gets scary, is that you just never feel like there's that sense of like, I can never feel rested. Yeah. Does that help?
And so do you tend to have pain with that? You know, I'm thinking of like fibromyalgia. I mean, there's a pain that goes along with that. Is there also pain or joint aches that goes along with CFS?
Often there is. I see fibromyalgia as a continuation of the chronic fatigue syndrome, myalgic encephalitis, that it's a continuation of the same processes, the same root causes that lead to chronic fatigue also lead to fibromyalgia, with a slightly different presentation just due to that person's body and how they experience it.
So I'm going to throw something kind of different in here, because as
Please.
we've talked, it's kind of brought this up for me. But
Yeah.
I remember many, many years ago, Lyme disease being treated as like a mystery illness too.
Yes.
People wouldn't recognize it. They wouldn't take people seriously. And there are some very similar types of symptoms, I think, with Lyme disease, and it just was not being recognized, and it wasn't being treated, and people could go back to the doctor and say, but I'm still feeling this, and they just didn't recognize it.
Right.
So do you lump all of that into the same type of thing, or now that they've come up or recognized Lyme disease? I don't even know with Lyme disease how easily and quickly it's do they have a specific test for that now?
Yes and no. So there are tests for Lyme disease. The Lyme disease test that is most commonly accessible through Quest and LabCorp, you know, all their standard labs. There's a very bizarre thing where they discount some of the bands that need to show up for it to be a positive Lyme test. They discount those for a super bizarre reason. Do you want to hear it?
Yes.
In the 1970s, they came up with a vaccine for Lyme, and they thought everyone would have that vaccine, and therefore everybody would have those positive bands, and they wanted to discount those. But the vaccine ended up not working out. And so they ended up discontinuing the vaccine. So lots of people haven't had that vaccine, but they haven't changed the way that they do this since the 70s. It's ridiculous. So there is a test. There's a lot of other companies that do all the bands that people can pay for those tests. It's still tricky though with Lyme, because Lyme can wax and wane in a person's body. So you can have chronic Lyme and it can still not show up on the test if it's in one of its states where it's not reactive. So it's really, you have to take a good history to do that. So to answer your question, do I lump Lyme in with chronic fatigue? One of the root causes of chronic fatigue are infections, and that's one of the 5 root causes. And so Lyme would go under that. So yes, in a sense, it is under that. That said, Lyme has its own intricacies in terms of treating. So if somebody is struggling with Lyme or think they are, I really recommend that they work with a Lyme literate physician, because they're going to get the most success from that. It's a very interesting pathogen. Yeah.
It's very interesting to me that, you know, our medical research, etc., has come so far, and yet some illnesses like that, like ME, CFS, is really kind of left behind.
Right.
And is there any kind of research going on that in the medical world where people believe this is very real and they are researching it?
Oh, 1,000%. There's tons of research. I mean, I put together programs for physicians, and I go through all the literature. I'm just redoing that now. There's tons and tons and tons and tons of literature. There's definitely people who really believe this, and often those people have had it themselves. And they're researchers, or they're physicians like I am, and so they take that deeper look in. And so yes, there is a lot, but again, I think that historically that they've been looking for that one thing. Now that those researchers who dive into the detail and look for the one thing are very helpful, because they can uncover clues for those of us that are putting things together. Like, oh, here's a clue and here's a clue. What can we make of this to help the patient that's sitting in front of us?
And so I'm assuming, with you being a naturopathic doctor, you have got some natural ways that you treat people. So I'm sure that how we eat, is one of the things that is a key to helping this.
Absolutely. Absolutely. Yeah. I mean, if I was to take a step back and say, okay, so how is it different that I am looking at it and that I share with other physicians how to look with this, and how I share with people who come into my programs and work with us, is to take a look back and to go, there's two things that two big things you need to look at. One, you need to look at your health foundations. There are 4 health foundations that are essential for all of us to thrive.
Yes.
And addressing those health foundations allows you, if you're sick, to get that, literally that foundation under you, so that no matter what treatment you're doing, conventional, natural, whatever, it's going to work better. It's going to work better for sure. And it's also those same health foundations that allow us to really avoid going into relapse, which is very common with chronic fatigue. And it also allows us to excel. I mean, to just like go for it, because you have that strong foundation, like a tall building, right? I'll say it's like a tall building. If you want a big, strong building, you have to build a big, deep foundation. So those foundations are very important to look at. Your sleep and your digestion and your rhythm and all of those types of things are very essential. And then the second big group, and this is where I really, if anyone's out there listening who is struggling with their energy and has chronic fatigue, ME, or fears that they do, or burnout, is you may have one of the 5 root causes, or you may have 3 of the 5 root causes. There are 5 root causes, and you may have 1, 2, 3, or all 5 of them. And so going through the process of figuring out which ones are yours, that's going to help you determine your treatment. So that's a really big difference, instead of looking at, okay, what's the one thing, right?
Yeah. I think even in, I'm looking at this even from a hormone perspective, when people go into perimenopause, they're not just affected in one way, or how people can treat it naturally is different from one person to another.
That's right.
So what might help me might not help the other. And of course, again, there are different issues they're facing. Are they estrogen dominant? What's their progesterone? What's their testosterone? I mean, there are so many things that come into play, and it's the same with this. I mean, it's a very complex condition, right?
It is complex. And I feel like what I had to do when I got so sick the second time was the complexity became more simple once you have a system to look at it with and go, how are the health foundations and which root cause? And I'll tell you, one of the root causes is a hormone imbalance between the adrenals, the ovaries, and the thyroid, what we call that hormone triangle in functional medicine. And so for me, that second time, like I said, I crashed. And part of it was perimenopause. There's no doubt about it in my mind that was part of it. It was also severe pain was ripping my neurotransmitters straight out of my body, Yeah, estrogen is an amazing stress buffer. It really helps us manage stress. And so when that estrogen goes down when you're in perimenopause and postmenopause, you don't have as much of a buffer, progesterone as well, as much of a buffer to handle the stress of our day-to-day lives. And so if we're really burning the candle at both ends, like people do who are high achievers, or big passions, and parents who are working, and women who are doing it all, we burn the candle at both ends, and it's like our body can't handle that stress as well. And we don't know how to adapt it.
Right.
Yeah.
Stress is a huge foundation for so many of our illnesses. If we don't learn to manage our stress, it really gets a hold and can be very bad.
Right. Yeah. And that connects in with one of the other root causes, which is where it can be the fear danger response, or it's called different things, limbic kindling, or fear danger response, or cell danger response, or the freeze response. And if we're under prolonged stress for a long period of time, it can trigger that. And that's one of the root causes. And I see that a lot in people who have been experiencing pain or fatigue or stress for a long time.
So what's the best way for people to find the answers that they need, especially if they're struggling with fatigue and they've got all these questions in their mind?
Yeah, so I think one of the best ways is they're welcome to come to my website, drjennytufenkian.com. And there's a quiz on that homepage, which is, what is your root cause of fatigue? And take that quiz. I also have a training right now that's up, and you're welcome to check that out, where I go through the foundational 4 and the 5 root causes, and you can see where you land, and you begin to pay attention to what it is that you need to do to support your health at this time. And they're certainly welcome to check out. I have a Facebook group that they're welcome to check out and join called Vitality.
Awesome. So I will put all of your links in the show notes, but repeat your website again where they can find it.
drjennytufenkian.com.
And yes, I will have that all there. That quiz, I think, will be very, very helpful for people.
Yeah.
I know we were talking just before we got on the air about how tired I am at the moment.
Yes, I know. It's just like, should we just talk about that? I'm very happy to just talk about that. Maybe I should tell you do we have a minute? Can I share another? So when I say there's 2 things that we can do when we're really exhausted, like you're doing right now. And one of them, because you started to ask me about diet, and there's one key thing you can do when you're really tired that can really help with the diet. And we call it protein our way through the day. It's the same thing. It works great for jet lag too, which is really keeping your protein levels up throughout the day, so your blood sugar doesn't crash at all, and avoiding the simple carbs, and actually avoiding caffeine too. And just doing protein and vegetables like every 2 to 3 hours can really help stabilize that adrenal stress response that happens with low blood sugar. And then the second thing is pacing yourself and taking breaks. Have you ever done an 11-minute Shavasana? You ever heard of that?
No.
Do you do yoga at all?
I don't. I've thought about it, then COVID hit, and then all the yoga studios shut down. Instead of taking advantage and doing it online, I just keep saying, one of these days I'm going to do that.
Right. Well, there's this thing at the end of a yoga class called Shavasana, where it's basically nap time. And after you do your yoga, you get to lie on your mat for a few minutes, and, they play pretty music or whatever. And it's amazing. It's amazing restorative pose. It's called restorative pose. Well, there's a thing that I learned where you can do an 11-minute Shavasana once or twice a day. And this really helps reset your energy throughout the day. So I set my phone to 11 minutes. I lie down, I put something over my eyes, and I just let my timer hold me. Any thoughts that come up, I just let them go. I did this in my clinic. I've done this at home. When I'm really pushing and I've got deadlines and tons of things to do, like you do right now, taking that 11-minute stop is like telling your body, I love you. I'm taking care of you. It's okay. And it's astonishingly restorative. I highly recommend you check that out.
Yeah.
And there are ways that you can do to pace yourself to really boost your energy.
Well, that's so very helpful. I appreciate you being on here with us today and all this great information. One of those things that people don't talk about. So I'm glad that we've had a chance to chat about it. So do you have any last minute tips or suggestions for our audience?
I think that what I would say is, if you're struggling with your energy, don't give up hope. I always believe, I say, keep knocking on doors, keep knocking on doors, doors will open, and you're going to find your answers. You're going to find your way. Just trust that there is a way for you to heal, and seek out those that you feel like you have some sort of a connection with, and just keep going. I know that you have a place inside of you to find that light.
Awesome. Thank you so much. I will put all of your links, as I said, in the show notes so that people can find you. And I would encourage everybody that's feeling any kind of fatigue to go there and take your quiz. I think that's awesome.
Thank you, Lynn. Thank you so much for having me. And thank you, everyone, for listening.
Thanks.